Hi, everyone. My name is Dr. Michael Wald, the Blood Detective, and welcome to today's podcast entitled Eat a Steak, Get a Urinary Tract Infection. It's no joke. For those of you who don't know me, I'm a doctor of chiropractic. I also have a medical diploma, but not an active license to practice medicine. I'm a board certified nutritionist, dietitian, sports nutritionist, and I have a master's degree in nutrition. I'm a life coach, and I also provide acupuncture to my clients. So let's get into this topic. First, I'll say that this information is for your education. It's not meant as a substitute for sound medical or health advice. And yes, you can be having chronic urinary tract infections because of handling meat. Here's why. Undercooked or contaminated steak can contain E. coli or Escherichia coli bacteria that survive digestion. It's not killed in the gut, and it can colonize or grow in the intestinal tract, and then certain strains of E. coli move from the gut to the urinary tract, particularly in females, causing inflammation and an infection. That's how it happens. So if you have chronic UTIs, whether you're a man or a woman, you want to take this information very seriously because your regular doctors won't bring it up. If you mention it to them, they will say, oh, yes, we know that that can happen. But there's no attempt at teaching people how this works and what to do to avoid this problem. Because what is the problem? The problem is you continue to get UTIs and you can continue to get antibiotics. Sometimes the antibiotics work, sometimes they don't, and you're treating resistant bugs. So we want to avoid the overuse, even just the minimum use as possible of antibiotics, only when needed. So we have to mitigate these particular environmental causes. So cross-contamination of food, like steak, during food handling, using the same utensils or surfaces for raw and cooked meat will and can spread bacteria. Antibiotic resistant E. coli from livestock raised on antibiotics can establish infection that's harder to treat. So why is it that E. coli resistant infections, why are they resistant in the first place? And you might have an E. coli resistant bacteria infection from cows because they give the cows antibiotics, and in those cows that kills a lot of bugs. But the reason they usually give antibiotics is not to kill infections in cows. It helps maintain more meat on the animal. So they give them these antibiotics, they kill some bugs, some E. coli, but then there's always resistant E. coli. Then when you eat the meat, you're literally eating those bugs, then they're in your intestinal tract, then they start to reproduce like crazy because they love the environment in your intestinal tract, and then they migrate over to the urinary tract. So a weakened immune system could be one of the reasons why you keep getting infections. Maybe it's that. Or poor gut barrier that allows bacteria from the gut to get into the bloodstream and make its way into the urinary tract. So you might have a condition called leaky gut syndrome that's predisposing you to transferring E. coli to the urinary tract. Now that, of course, is a problem in and of itself. Now, once in the urinary tract, the E. coli can adhere or stick to the bladder wall, multiply, and trigger symptoms like burning, urgency, and discomfort. And by the way, the most common symptom in a woman of a UTI is not pain upon urination, it's back pain. It's back pain, and it's almost never recognized as that, but you can look it up. It's the actual truth. So what are some ways to avoid this particular problem of E. coli infection, urinary tract infections from meat? Cook steak to a safe internal temperature, 145 degrees Fahrenheit with rest time, to destroy the harmful bacteria. Avoid cross-contamination of the meat to other aspects of other food you're making, for example, on your hands, your body, by using separate cutting boards and utensils for raw and cooked foods. I use a stainless steel cutting board. That's the only thing that's safe. And the same thing with the utensils, stainless steel. They can't be wood, they cannot be plastic of any type. Wash hands thoroughly after touching raw meat and before handling other foods. So wash your hands for about 2 minutes. Make sure to scrape the soap underneath the nails because that's where a lot of these bacteria can colonize, and you can pass them on to other people. So wash hands thoroughly, as I said. Purchase meat from reputable, clean sources. preferably a grass-fed and antibiotic-free. Very, very important. Strengthen the gut and urinary defenses with probiotics, with cranberry pills or cranberry juice, adequate hydration and plant-based fiber. Support immune function with balanced nutrition and avoidance of excess alcohol. All of these things can lower immunity and make it a lot harder for your body to combat and to kill the E. coli, so it gets in the body and it's very hard to kill. In terms of some of the tests to think about to get to the bottom of your urinary tract infections, comprehensive digestive stool analysis, known as a CDSA, will let us know how healthy the gut is, because again, that's where the E. coli is going to go first. If it's a leaky situation going on, you're in trouble. Intestinal permeability, that's the leaky gut thing, aspect of gut health I was describing, so that is important. Also, urinary organic acids and microbial metabolites test. That helps to identify bacterial toxins and overgrowth markers. And then an immune panel, comprehensive panel, which evaluates white blood cell activity, inflammation, and infection risk. These are just some of the tests I might think about. Depending on your situation, it might be others. But these are the main things that get at the bottom of why you have chronic infections. And basically, once that's figured out, a nutritional supplement and food plan is given to the person. When I look at their supplementation, we want to give them levels of supplementation that are appropriate to the health situation. And I should also state that I like to compare your results of these tests, not just to the ranges of normal that the tests will tell you. Those are based on average, seemingly well people. We also want to compare your labs to very healthy people, because if we do that and get them in that category, your chances of getting a urinary tract infection, even when exposed to E. coli or other types of bacteria, will be a bit less. So thanks for joining me for this brief, but I hope useful conversation regarding E. coli and how steak, or any food really, even bananas can have E. coli on them, can cause resistant urinary tract infections. See you at the next one. Thanks for joining me.